If you're over 65, chances are you're swallowing a handful of pills every morning. One for blood pressure, one for your heart, maybe cholesterol, maybe diabetes, and you've probably been told for years, take these meds regularly, they're keeping you alive. But here's the shocking truth. Some medications that helped you at 40 can do the exact opposite at 70. Your body doesn't work the same way anymore. Your liver doesn't clear things out as fast. Your kidneys can't flush out the excess. And those innocent-looking pills can quietly build up, leading to falls, memory loss, even organ damage. A 2023 study published in JAMA Internal Medicine proved it. 63% of patients over 65 are taking at least one unnecessary or harmful medication, and 40% of them have no idea. In this video, I'm going to expose 5 major medication mistakes that doctors aren't telling you about. And most importantly, I'll show you what you need to do about it. Mistake number 1 is especially dangerous because it increases Alzheimer's risk by 54%. Yeah, you heard that right. Let's get started. Grab your pill bottles, let's look at those labels, and let's learn the truth. For years, they told you 1 aspirin a day keeps the heart attack away. And that was true in your 50s, but by the time you hit your 70s, things changed. Here's the problem. Aspirin thins your blood. That's helpful for young blood vessels because it prevents clotting. But as you age, your blood vessels become more fragile, and aspirin, especially in high doses, can lead to internal bleeding, stomach ulcers, brain hemorrhage, even bleeding in the eyes. The 2018 ASPRI study, published in the New England Journal of Medicine, followed 19,000 people over 70. The result? Those taking daily aspirin had a 38% higher risk of serious bleeding. And what's even more shocking, there was 0 reduction in heart attack or stroke risk. So aspirin wasn't protecting you anymore, it was just putting you in danger. The symptoms: frequent nosebleeds, bleeding gums, bruising easily, black-colored stool, sign of stomach bleeding. What should you do? Ask your doctor. Do I still need aspirin? If you haven't had a heart attack or don't have stents, you probably don't need it anymore. Instead, omega-3 supplements, natural blood thinner, Mediterranean diet, fish, olive oil, vegetables. Regular walking aspirin isn't a miracle for heart health. After 70, it can do more harm than good. Heartburn, acid reflux. Sound familiar? You were probably given a PPI like omeprazole, lansoprazole, or pantoprazole for it. Maybe you've been taking it for years. But here's the danger. These drugs almost completely block stomach acid. In a young body, that might not be a problem. But after 65, stomach acid isn't just for digestion. You also need it to absorb vital nutrients like B12, calcium, and magnesium. When PPIs are used long-term, your bones weaken, calcium doesn't get absorbed. Your memory deteriorates, B12 deficiency. You catch infections, stomach acid kills bacteria. Kidney damage, risk increases. A 2016 study published in JAMA Neurology was shocking. Older adults using PPIs had a 44% higher risk of dementia. The symptoms: constant fatigue, memory problems, tingling in legs, frequent infections. What should you do? Don't stop PPIs suddenly. But talk to your doctor about reducing the dose or using it intermittently, switching to H2 blockers like famotidine, safer, avoiding reflux triggers, caffeine, alcohol, fatty foods. Elevate your pillow. Don't lie down for 3 hours after eating. PPIs are for short-term use. Taking them for years quietly damages your body. You can't sleep. You're anxious. Your doctor gave you a benzodiazepine like Xanax, Valium, or Ativan. At first, it worked great. You calmed down. You slept. But here's the truth. Benzodiazepines were designed for young brains. Your brain, after 65, processes them much more slowly. The drug builds up in your system, its effects lasting all day long. The result? Drowsiness, dizziness, loss of balance. And that leads to falls. 1 out of every 3 falls in people over 65 results in a fracture, surgery, even death. A 2014 study published in the British Medical Journal found older adults using benzodiazepines had a 48% higher fall risk. Hip fracture risk was 50% higher. Plus, they're addictive. Your body gets used to them, and when you stop, you can experience rebound anxiety, tremors, even seizures. The symptoms: daytime dizziness, unsteadiness while walking, brain fog, increasing forgetfulness. What should you do? Never stop cold turkey. Taper down slowly under doctor supervision. Instead, try melatonin for sleep non-addictive, cognitive behavioral therapy for anxiety, breathing exercises, meditation, regular exercise, natural endorphins. Benzodiazepines are for short-term use. Taking them for years dulls your brain and multiplies your fall risk. Here's a scary fact: 40% of Americans over 65 take 5 or more medications daily, and most doctors don't know what other doctors have prescribed. The problem? Medications interact with each other. One drug reduces another's effectiveness, or two combine to create a toxic effect. Examples: blood pressure, med plus pain reliever equals kidney damage. Anticoagulant plus aspirin equals serious bleeding. Antidepressant plus sleep, med equals drowsiness, falls. A 2019 study published in Annals of Family Medicine. Seniors taking more than 5 medications had 3 times higher hospitalization risk. What should you do? Write down all your medications, prescription, over-the-counter, vitamins included, and show your doctor. Ask, do I still need all of these? The goal: as few medications as possible. Sometimes stopping one drug helps another work better. Here's the most dangerous group: anticholinergic drugs. You might not have heard the name before, but you're probably taking one of them. What are they? Allergy medications, Benadryl, sleep aids, Tylenol PM, bladder control drugs, oxybutynin, antidepressants, some types, stomach medications, some types. These drugs block a chemical in your brain called acetylcholine. Acetylcholine is critical for memory, learning, and muscle control. When you're young, your brain can compensate. But after 65, brain cells are already declining. Anticholinergics speed that up. A massive 2019 study published in JAMA Internal Medicine. 70,000 people, 20-year follow-up. Those using anticholinergics, 54% higher dementia risk. The effect is permanent, even after stopping the drug. The symptoms: forgetfulness, confusion, dry mouth, blurred vision, difficulty urinating. What should you do? Ask your doctor, is my medication anticholinergic? If so, there are alternatives. Allegra, Zyrtec are safer for allergies. Natural solutions: pelvic floor exercises for bladder control. These drugs might relieve your symptoms, but they're quietly damaging your brain. Not worth the risk. Here's the truth: after 65, your body works differently. Liver, kidneys, brain, they've all slowed down. Medications that used to help you can now hurt you. But here's the good news: you can control this situation. What you need to do today: list all your medications. Ask your doctor, do I still need these? Check for interactions. Switch to natural alternatives whenever possible. Remember, more medication doesn't mean better health. Sometimes less is more. If this video opened your eyes, hit that like button. Share it with someone you know because they might be making the same mistakes. And subscribe to our channel because we share life-saving information like this every week. Now here's my question for you. What medication are you taking? And will you change it after what you learned today? Write it in the comments. I read every single one. Keep making the right choices to stay healthy, strong, and live longer. See you in the next video.